A 37-year-old man is brought to the emergency department following a fall on an outstretched hand. Physical examination reveals abrasions on his palms as well as edema and tenderness of the right upper arm near the elbow joint. An x-ray of the affected arm is shown, which of the following is likely to also be found in this patient. And we have this image here which looks like the elbow joint of one of the arms. Choice A, difficulty extending the wrist. Choice B, difficulty adducting the thumb. Choice C, ape hand. Choice D, claw hand. Choice E, difficulty supinating the arm. I'll wait 5 seconds and answer the question. So once again, we have one of these upper extremity innervation questions. These are very popular NBME questions. They test on these all the time, and you just gotta know them. I mean, here I give you an image, and it's clear that this is a supracondylar fracture, which if you're at all familiar with your arm innervations, you should know that that is a median nerve injury. This is one of the most well-known spots for median nerve injury alongside the carpal tunnel. And very occasionally, pronator teres muscle can also kind of compress on the median nerve, but that one doesn't show up as often. So anyway, median nerve injury, median nerve is used for pronation, flexion of the wrist and fingers, flexion, abduction, and opposition of the thumb. So we don't have any answer choices here stating the obvious one, which is flexion of their fingers or wrist. So we're going to have to look for something else. So as I just mentioned, the thumb in a median nerve injury has difficulties flexing, abducting, and opposing. And when you are lacking those actions, what happens is that your thumb can be permanently rotated and adducted. And I guess some really old doctors used to think that this makes your hand look like a monkey's hand, and they call it an ape hand. Choice C is the correct answer. So you gotta know that median nerve can result in not just a issue with flexing your wrist and fingers, but you can also have this problem with your thumb, where they call it an ape hand. Your thumb will be internally rotated and it will be adducted because that's the only actions that are not impaired, right? Some other things you want to know about the median nerve, of course, it innervates the first 3.5 fingers in terms of more surface anatomy. And one of the other signs you can find with median nerve injury is the hand of benediction. That one doesn't show up as often, but I will compare it to claw hand in a second. But for the moment, just know that hand of benediction is when you try to flex your fingers or make a fist. Because you have an injury of the median nerve, your index finger and your middle finger have a difficult time flexing, but because your ring finger and your pinky have innervation from the ulnar nerve for flexion, you can flex those. So you'll end up making this hand sign that I guess some people thought looks like the patient throwing up kind of this religious hand symbol. So that's why they call it the hand of benediction. So instead of going down these incorrect answer choices one by one, what I'm going to do is that I'm just going to review some of the other high yield points for the other upper extremity nerves, because it's really important that you be able to sort this out in your head, okay? So first I want to mention the axillary nerve. That one's the easiest. If you get a humeral neck fracture, you should be thinking axillary nerve damage, and that innervates the deltoid, teres minor, and you should just be thinking arm abduction. Pretty simple. Next one is radial nerve. The two you want to know is, of course, axillary compression, either through the use of a crutch or what they call Saturday night palsy, which is where I guess some people used to fall asleep on a chair on Saturday night and they compress onto their axilla by having their arm around the chair, so they just call it Saturday night palsy. That's a radial nerve palsy. And the other one that's really important, and I've made a video about it before, it's a mid-shaft humeral fracture. You just need to know instantly that's a radial nerve. It's 3 points. Okay, you gotta know that. So you also need to know, of course, that the radial nerve is very much responsible for the extensors of the arm. Brachioradialis, extensors, supinator, which is choice E here, and it also innervates the triceps. One of the highest yield things you want to know about radial nerve injury is what you call the wrist drop. So because I have difficulty extending the wrist and fingers, my hand will be pronated instead of supinated, because like I said, this supinator is damaged or supinator doesn't have innervation, and I can't extend the wrist or fingers, so the wrist will be dropped down as well as my fingers, which is choice A here, right? Difficulty extending the wrist. I, of course, didn't put as alternate options here pronation of the arm or flexion of the wrist, because both of those things could have been correct answers in this case, right? So we just have answers B and D left, and that brings us to ulnar nerve injury, which two of the big ones we want to know is cubital tunnel syndrome, which is just compression of the ulnar nerve at the elbow, and Guillain canal, which can happen because of a fracture of the hook of hamate. Either one of these can damage or compress the ulnar nerve. Ulnar nerves used for flexors, the fourth and fifth digits, as I mentioned a bit earlier. It innervates the lumbricals, which are used to flex the MCP joints and also extend the PIP and DIP joints. Ulnar nerve also innervates the interossei muscles, which lets you abduct and adduct the fingers. And it also notably innervates the adductor pollicis muscle, which is what you use to adduct the thumb. They like testing on this one because almost every other action on the thumb is from the median nerve. So they like testing on adductor pollicis because it's essentially an exception to the innervation of the muscles to the thumb. So some of the things you can find with ulnar nerve injury is ulnar claw, which is when you try to extend the fingers because you have an inability to extend the PIP and DIP at the fourth and fifth digits, as I mentioned before. You'll end up with a ulnar claw or claw hand, which was choice D here. Now, real quick, I want to contrast ulnar claw with hand of benediction because sometimes people get these two confused and they look very similar when you look at pictures of them. The key here is knowing when they happen, because hand of benediction is because you have a flexor issue, so you tell the patient to make a fist and they'll have the hand of benediction. And ulnar claw is basically the opposite. You tell them to extend the fingers instead, and because the ulnar nerve supplies an extensor at the fourth and fifth digits, they will have difficulty extending the fourth and fifth digits instead, so that will cause the ulnar claw. So once again, hand of benediction, median nerve, it's when you tell them to flex. Ulnar claw, ulnar nerve, it's when you tell them to extend. Other thing you want to know about ulnar nerve is Froment sign, which is where you can't hold a piece of paper between your thumb and your index finger, because normally you can just adduct the thumb to hold it in place like that, but because the ulnar nerve is damaged, you cannot adduct the thumb, and what will happen is instead you'll flex your thumb to hold the piece of paper in place because you're essentially using the median nerve actions to hold the piece of paper. And that's choice B here, right? Difficulty adducting the thumb, as I mentioned. So just to sum it up once again, going top to bottom anatomically, or superior to inferior, humeral neck fracture, that's axillary nerve damage. Mid-shaft humeral fracture, that's radial nerve damage. Supracondylar fracture, like this patient, median nerve. And then cubital tunnel / Guillain canal syndrome, that's ulnar nerve. And of course, remember that radial nerve is mostly used to extend, and that the median and ulnar nerve are both mostly used to flex the fingers and wrist. I hope you found this video helpful. I'll see you in the next one.